Nice to see you again.
Nice to be here.
So, one of the things that I wanted to cover this time around was this idea that as vaccines are becoming more available, the age is coming down that people can access it. And so I'm getting lots of questions from my patients who are pregnant, should they get vaccinated? How do they, you know, how do they, how do they think about this? And I'm wondering, what are you saying to your patients, or what do you think I should say to my patients who are in that situation?
Interesting. When the vaccine became authorized, we didn't we didn't have a lot of data on pregnant women because they were not included in the clinical trials. There were maybe a couple of dozen that had inadvertently been pregnant in these initial clinical trials. But the risk of COVID in pregnancy has always been pretty well recognized as so bad in terms of severity and ICU stay and outcomes that many experts recommended that pregnant women go ahead and get vaccinated. Now we actually have some data on that, and it's pretty robust. It comes out of this a registry called VSafe in the US, where they had over 35,000 pregnant women, and many of them had completed pregnancies, and there were no worse adverse outcomes in those who actually had gotten vaccinated. As a matter of fact, just like in the general population, the top adverse event was a sore arm. So very reassuring to now say to our pregnant women, there's a way to protect you, and we actually have data backing that recommendation up.
So it is really helpful. That's really great to be able to say to our patients, we actually have data from tens of thousands of successful pregnancies where the vaccine, protected mom and baby. And we have data from all those pregnancies showing no harms, eh?
Yep.
Okay. So at the same time, I don't know about where you are, but here in Toronto, we're seeing actually ICUs filling up in ways we didn't see before in terms of pregnant women. It's really been quite shocking. And I'm wondering, why are we seeing that now?
Yeah, so it's also a really unfortunate phenomenon noticed also earlier on. So even with the first and second wave, people saw that pregnant women seem to have worse outcomes if they got COVID, if they got the disease. Now with this third wave, and a lot of it variant-driven third wave in many parts of the country, we're now seeing these vulnerable patients, such as these pregnant women, end up with severe disease. And there's actually a study published today that, again, validated a lot of what we're seeing clinically in a research kind of way. So they looked back at pregnant women, and they actually saw that they had much higher risk of complication, preeclampsia in pregnancy, so high blood pressure, and also preterm delivery. And overall, they were 22 more likely. So a pregnant woman with COVID is 22 more likely to die during pregnancy than those that didn't have COVID. As a pediatrician, I also worry about the baby. So we know that if you're a pregnant woman with COVID, you have a much higher likelihood of ending up in the ICU yourself. And then the baby has a much higher likelihood of ending up in the NICU. And we know also that babies, especially the younger ones, so all infants under 12 months of age, but the younger it is worse, are also a really much higher risk of severity for COVID itself. So it's a bit of a double whammy because you have these pregnant women who are at risk, you have their babies who are at risk. Now we actually have evidence that says that they are worse, but the silver lining is that we also have evidence that the vaccine is safe in this population. Hence the push from a lot of groups saying we should prioritize these women in terms of getting their vaccine.
So that's really, really useful for me when I'm counseling my patients, is now to be able to say, it's not like wave one anymore. It's not like even just 4 months ago when the vaccines were just coming out. We now know so much more about vaccines and their safety and their effectiveness in pregnancy. And we know so much more about why they're needed, because these these women and their babies are ending up in ICU. And then, I often get these questions about, well, how do I know it's safe in the long run? And one of the things that I say when that comes up is, um, what we know is that the vaccine itself doesn't cross the placenta, but the antibodies do. So mom's protection that she gets goes ahead and protects her baby. And what more does any mom want than to protect her newborn?
Exactly.
So one other question that has been coming up in this realm is, what about women who are thinking about fertility? We see a lot of rumors around that online. What are you saying to people there?
Well, they're just rumors. So this came up pretty early on, where people were worried that there might be a protein in the placenta that could be looking a little bit like the spike protein, and potentially you could have immunity built to your own placenta. And that hasn't been shown at all to be the case, not with COVID-19. So they're not more early miscarriages in first trimesters when women get COVID-19 in the first stages of pregnancy, and it's definitely not been shown to be the case with the vaccine. And again, now we have data that says that's not it. So we don't have any more adverse events, therefore we don't worry about this being an issue to fertility at all.
Yeah, I think it was difficult to answer it with certainty before, other than to say, the source of those rumors did seem to be coming from foreign countries that were sowing discord. But now we can actually say, no, we have really good evidence about the safety at this point, and that people can readily get pregnant whether they had the vaccine or not. Okay, that pretty well covers what I wanted to cover this time around. I'm sure we'll have lots more questions coming up.